Anyone who wears contact lenses is at a much higher risk of developing dry eye syndrome. In today's video, I'm going to tell you about the 6 tips that I tell all my contact lens patients who are also struggling with dry eye and have trouble wearing their contact lenses for more than a few hours at a time. Hi everyone, my name is Dr. Saya Nagori. I'm a board certified ophthalmologist and a contact lens wearer, and I also do suffer from dry eye because of my contact lenses, but I love wearing my contact lenses, so I actually do a lot of the things that I'm going to educate you on today. Let's get into the 6 tips that I have on what you can do to help make your contact lens wearing experience much better and improve any dry eye associated symptoms. So when it comes to contact lens associated dry eye, you are not alone. Actually, many studies have well documented this, and contact lens wearers are about 74% more likely to develop dry eye syndrome when compared to patients who don't wear contact lenses. So why does this happen? The main reasons are that the contact lens can induce some instability into your tear film. And then of course, because the contact lens actually sits on the eye, there is friction between the lens and the surface of the eye, which can be disruptive. A study involving 415 contact lens wearers found that 55.3% reported contact lens related dry eye. That's over half of the patients. But this doesn't mean you can't wear contact lenses. It just means that you really need to optimize your eye health and optimize your dry eye syndrome. So let's get into the 6 tips. Number 1, if you are not already in a daily disposable lens, I want you to talk to your doctor about switching into a daily disposable lens. Fresh, clean lenses every day mean fewer deposits and less buildup that can irritate dry eyes. Daily disposable lenses also tend to be a little bit thinner, so they may retain moisture a little bit better, but this is also going to vary from lens to lens. But in general, daily lenses are a much better choice than any lens that you're going to put into a case and then put back into your eye the next day. Tip number 2 is to get a pair of glasses that you really like. This is so that you can take a contact lens holiday. These are days when you opt to wear glasses instead of your contact lenses. This gives your eyes a rest and a chance to rehydrate naturally without the added strain of having that contact lens on. Tip number 3 is going to be to use preservative-free artificial tears. Regular lubrication is going to help keep the surface of the eye moist and comfortable, and preservative-free formulas avoid the additional irritation that preservatives can cause. Now, in addition to preservative-free tears, you can get a thicker gel-like tear that you can use at night, and this one does not necessarily have to be preservative-free. Just make sure that your lenses are off before you put it in your eye. Because it's a thicker gel substance, it will provide a little bit more intense hydration, but the problem is also that it can make your vision a little bit blurry, so you want to make sure that you're already in bed or don't have something that you need to read or do any work right after you put the drop in. Tip number 4 is to treat any underlying blepharitis. This is a condition where there's inflammation along the eyelid margins, and actually there's small glands in your eyelid that are responsible for creating a pretty important part of your tear film. So if you treat your blepharitis, and there's another video on this channel where you can look at how to treat it effectively, you're going to reduce inflammation in the eyelids and also improve the quality of your tears, which is going to prevent your tears from evaporating too quickly. Tip number 5 is optimize your environment. If you're in a dry environment, consider getting a humidifier. So for instance, if your office space is really dry and that's where you work and that's where you use your eyes the most, if you have a really dry office space, getting a humidifier and making that environment not as dry can really improve your dry eye symptoms. You also want to avoid things like having a fan on at night or even having a fan on at work, because this is going to dry out the eyes more. Finally, tip number 6 is get your eye doctor involved. There are prescription treatments such as anti-inflammatory eye drops and medications that can actually make more tears for you that can provide longer term relief. Some of these are prescription only, so you will need to see an eye doctor to actually get the prescription. There's also in-office treatments like punctal plugs and IPL that can also really help for dry eye. I know how important it is, at least for me, to wear my contacts every day because I actually feel like more comfortable in them and I feel like I see better in them. So I know that treating dry eye is really important so that people can continue to wear their contact lenses as much as they want to. Hope you found this helpful. Remember to hit the like and subscribe button below, and I'll see you in the next video.